So today we have 3 periods to report on. Between Friday and Saturday we had 556 new cases reported here in British Columbia. Saturday to Sunday an additional 598 people were diagnosed with COVID-19, and then from yesterday to today another 631 people. This is 1,785 new people diagnosed with COVID-19 across the province, 2 of whom were epidemiologically linked, bringing the total number of people who've been diagnosed with COVID-19 to 92,571 in British Columbia since this pandemic started. Of the new cases, 469 are in Vancouver Coastal Health, 1,010 were in the Fraser Health Authority, 89 people were in the Vancouver Island Health Authority, 84 people in the Interior Health Authority, and 133 people live in the Northern Health Authority. So that brings us up to 5,290 active cases in all areas of the province, and 303 of whom are in hospital right now, 80 people in critical care or ICU. We also have 9,330 people under active public health monitoring, and 85,746 people who have recovered from their acute illness. We've had, sadly, another 16 people who have died from COVID-19 since our last report. One of these was a historical death that was reclassified over the weekend, and 15 new deaths, bringing the total number of people who have died in British Columbia to 1,437. As we continue to make our way through this last stage of the pandemic, we remember every day the families and the care providers and the communities who've lost loved ones, and our thoughts are with you during this challenging time. We have no new healthcare outbreaks, and the outbreaks have been declared over at the Florentine in Interior Health and Chilliwack General Hospital as well. So that leaves us with 4 active outbreaks in long-term care assisted living or independent living, and 7 in acute care units around the province. We have also on the weekend had an increase in confirmed cases that have been identified as having variants of concern. 166 new cases have been retrospectively identified for a total of 1,366 cases in the province. 237 of them are active cases currently, and the remaining people are past their acute phase. The predominant variant of concern that we continue to see is the B117 associated with the UK, and we have 1,240 cases that have been identified with that variant. They are primarily in the Fraser Health and Vancouver Coastal Health region. In addition, we continue to have 41 South African cases, the B1351, with no new cases of that variant. But we have had an increase in the P1, the variant that's associated with Brazil. Another 20 cases in 2 clusters have been identified. So we now have 1,047 of these cases are in the Fraser Health region, 276 in Vancouver Coastal. We remain low on the island in the north. We're 8 and 5 respectively, and we now have another 10 cases in Interior Health, bringing the total there to 30. One of the things that we follow very carefully is whether the variants that we're seeing are having an increase in hospitalization or an increased risk of death, and so far we are not seeing that. There are currently 23 people who've been identified as having a variant case in hospital, but our overall hospitalization rate remains the same as what we're seeing, or slightly less than what we're seeing in the general population, around 5%. And we have not seen an increase in deaths either. As you know, this has been a week of ramping up of our immunization programs on several different fronts, and we've delivered over 539,408 doses of all 3 COVID-19 vaccines in BC. This puts us ahead of the schedule that we had originally been on, based on what we were expecting to receive. And as we talked about last week, the fact that we now have 3 safe and effective vaccines and that we're able to use in several different strategies has meant that we can move up our age-based strategy again this week. There's been some as well very positive news that's recently been released around the AstraZeneca COVID vaccine, with a recent trial that we've all been waiting for from the United States. The numbers being released, and it shows that the effectiveness or the efficacy in the trial of the AstraZeneca vaccine was 79%, putting it right up there in league with the Pfizer Moderna vaccines that we're seeing as well. And this is very good news. There were concerns that many of the regulators had expressed about the previous trials and when they had been done and how they were run. And this one is one that we know the US FDA has been waiting on. And it's very positive news. We want to see all the details, of course, but two important things. One is that the efficacy for even mild illness is very high, and it's even higher, close to 100%, similar to what we saw with the Pfizer and Moderna clinical trials against hospitalization and severe illness. So this is really good news for us. This is one of the other challenges that we've been working on and following, of course, around the world, is the immunization surveillance for safety signals. And that is something that we do here very meticulously here in BC, and we are part of a worldwide safety monitoring for the adverse effects from following immunization. We now have 497 APHIs reported in British Columbia, and all of these have been investigated. 50 of them were related to anaphylaxis or allergic reactions, and these continue to be monitored and treated, and making sure that everybody who's providing immunization knows how to respond to somebody with an allergic reaction. Of importance, though, we have not detected any other safety signals similar to what was seen, for example, in Europe. We continue to monitor the safety signals from around the world, and we are reassured by the investigation that the European Medicines Agency did, and that was done in Germany, that clotting remains extremely rare, and with vaccinations in the millions being given out around the world. We know that the benefits of this vaccine far outweigh any risk of blood clotting, and the minimal risk that we see from any of the vaccines compared to the risk that we get from infection with COVID-19. And I think this is important for us all to continue to follow. If we know that this virus can cause clotting, we've seen it, the histories of blood clots, of heart attacks, of pulmonary embolus, pulmonary blood clots and strokes from infection with COVID-19 remains very high and a very real risk. And the benefits that we have with all three of the vaccines that are available here in BC far exceed any risk from infection. I'd like to speak for a moment about how we are using the vaccines here in BC. We talked last week about the two parallel programs that we have. So the AstraZeneca COVID vaccine program is a parallel track. It augments the mainstay of our program, which is the Pfizer and Moderna age-based risk program that we've now been able to also move up so that people in their 70s are now eligible for appointments and are getting vaccinated. And I encourage us all to support the older people in our lives, our aunties, our uncles, our friends, to be able to get in and to get their vaccine in a timely way as soon as we can. In the parallel track, we have it allows us to be more flexible in dealing with where we are seeing outbreaks in our community now and addressing those hot spots and those high-risk areas so that we can protect workers and in turn protect our communities. We're using this vaccine with the local medical health officers, making decisions about where we are seeing risk and outbreaks and clusters right now to provide protection to frontline workers and those working and living in higher risk settings where we have seen repeatedly transmission can be high and it spills over into our homes, into our communities. Protecting these groups provides greater protection to all of us. It's addressing that transmission that we're continuing to see in the community. And this dual-prong approach, we've been able to accelerate on both fronts. And I recognize many people are eager to get their vaccine as quickly as possible, and it's not always clear why someone else is getting a vaccine ahead of you. It is important to remember that doing it this way, putting out those hotspots in those areas that we are seeing outbreaks happen, protects all of us and increases all of our protection and moves us all that bit further along the queue. While more and more people are getting vaccinated every day, it's very important that the risk for all of us remains high. And we see that in our 7-day rolling average. We see that in the increasing that we've seen over the last few weeks. You know, we ask about whether we're in a third wave. It really is. We've come down from the peak of our second wave, but we have leveled out for many weeks now. And it's a slow and steady increase. Concerningly, we're starting to see younger people who are being affected end up in hospital and needing hospital and ICU care, and that is concerning. At the same time, we're having more and more people protected by these vaccines, but we do not yet have enough protection to keep us all safe. In particular, we've seen this increase being focused in the Lower Mainland in particular, and people in hospital and in ICU in the Lower Mainland. This is a concern because, as we know, that is where the highest population density is, and this type of an increase can quickly get out of control, and that is something we don't want when we're at this phase of the pandemic. We know these escalating new cases have been connected to two main events. So people who are getting exposed and clusters in workplaces and in homes. We know now it's so challenging at this point after going through the last year of this pandemic and being at that place where we want so much to be with our families, with our friends. And we know that people are gathering together in indoor spaces. What I can say is we know that the B.1.1.7 variant is more transmissible. It's much easier to spread it with even minimal contact in indoor settings. The areas where we know it spreads most quickly and most dangerously are the same as they were last year, but now there's even less a margin for error. So that close contact, when we're inside, when we let our guard down, when we're talking in close contact with people where the ventilation isn't as good, those are the times when this virus can spread even more quickly. Indoor gatherings of any size continue to be a risk. The only safe place for us to gather now with our small groups, with our friends, with our family, is outside. And that's why we need to focus on the things that we can do together in those groups of up to 10 outside, where we don't give this virus a chance to spread. Our grandparents, uncles and aunties and cousins and friends who are older are still at risk of severe illness. This means that if you are thinking about spring weddings, birthday parties, other occasions, we need to push them to the summer. This is a time where we need to take those little sacrifices, all of us, so that we can continue to keep those important workplaces open. We can continue to support our children to be in school. And we can continue to support our immunization programs so that we can all be safe very soon. And for businesses, I also want to be clear. You must continue to have COVID safety plans, regardless of whether you've been vaccinated or employees have been vaccinated. It takes time for that to come into effect, and it takes time when we have this much transmission in our community. And we will, and we know that is happening around the province, take all necessary steps, including closing businesses where we're seeing ongoing transmission, if that is required, for at least 10 days. So for all of us, don't let up now. And if you are blatantly disregarding those public health orders, there are ramifications for that. For those anticipating an easing of restrictions, as I mentioned last week on religious gatherings, we're working on the final touches of amending the variants for outdoor religious gatherings based on the advice that I gratefully received from many faith leaders last week, and that will be coming in the next day or so. So the variants of concern are moving quickly. It makes it more difficult for us to have that leeway to do the things that are risky. To counter that, we continue to be slow and steady and to find our balance, our path to get to those brighter days, which are not that far away now. So let's make spring, this next 3 months, the time to be outside, to gather with people that we care for safely, and to remember to connect with all of our friends and family online. This is a very challenging time for people, and we know that those connections make a difference, but do them safely. Continue to use our safety layers, washing hands, wearing masks, keeping a safe distance from others, and always, always staying home if we're not well. The COVID-19 pandemic is still with us, but there are post-pandemic days ahead. We are not quite yet through this storm. So as we use our momentum and our vaccination programs and the things that we know work to push us forward, let's continue to be kind and to be calm and to be safe. Thank you.